Hey everyone, welcome to this week's answer session of Ask Dr. Dan. Again, this week we were talking about Botox injections. These injections are used to reduce fine lines and wrinkles in the face. And with that, we'll get to the questions. So the first question is, how long until you notice results? So we tell most people that they will start noticing some results by 5 to 7 days, and that it may take up to 2 weeks for the full effect to take place. So what we'll normally do is we'll have the patient come back in 2 weeks, and we'll take a look and see how everything appears. And if they need a little touch up, we can add another unit here or there as needed, because by 2 weeks we'll know how that first injection looked. The second question is, how long does Botox last? So it's a little bit variable. So we say on average Botox will last anywhere from 2.5 to 4 months. And then when people start noticing that they have a lot more motion in the face again, then they come back in for another round. What we will notice is over time, when people repetitively come in, sometimes the muscles just do weaken a little bit, so they'll get much longer than even 4 months out of their Botox. There are also a small amount of people that will actually get less time over time, so there's a lot of variability with that, but we tell most people about 2.5 to 4 months. Question number 3. Is there an age limit? So when I first started training in Botox, they told us to not do it to anybody over the age of 65. However, over the last few years, there's really no recommended age limit anymore. So it's really based more on medical history and medications and other things like that, but there is no age limit for Botox. Number 4, so is anyone not a candidate? So yes, there are certain medical conditions that you would not recommend doing Botox on people. So people that are uncontrolled diabetics, because they heal very poorly. There are some rarer conditions, something called myasthenia gravis or Eaton-Lambert syndrome. You obviously don't want to do this on somebody that's pregnant or breastfeeding, just because we don't know if there is any effect. There are certain medications, like certain antibiotics and blood thinners, that you would not want to do Botox if the patient is on that. But most people are good candidates for Botox. Number 5, is it painful? So no, it's not very painful. It is a needle, so you do feel a little pinch. However, the needles are very, very small. So really you don't feel a lot at all. There's typically just maybe a touch of bleeding, but again, nothing bad. It's a very easy procedure to do, and it's very well tolerated. We don't have to numb the face at all for Botox. It's very well tolerated. Number 6, how long does it take? So Botox is a very fast procedure. Obviously, some of it depends on how much of the face you're doing, but I would say 85% of patients, what they do is they do their forehead, what we call the glabellar complex, which is here and here, and then the crow's feet. So to do something like that takes maybe 5 minutes, maybe even a little bit less. Obviously, if we're doing more along the face, it might take a little bit more time, but again, it's a very quick procedure. And the last question is, can you combine this with other treatments? Absolutely. So actually, you can combine this with things like fillers, so to kind of fill in that lower face, the lips. You can also combine it with things like radio frequency, microdermabrasion. Radio frequency will tighten the skin, also help collagen regrowth. Actually, the way I like to do Botox is kind of the icing on the cake. So I prefer to use things like radio frequency to build up that collagen and thicken that skin. And then if there's still a little bit of lines left over, then we treat that with Botox. And typically you'll need less Botox and you'll need it less often, because the skin is already much stronger and the collagen and elastin have grown. Obviously, if somebody has a wedding in a week and they want to touch up real quick, then we'll just do the Botox, or if that's just what they want. But otherwise, I think a combination of treatments works very well. So those are all the questions this week. I hope you all have a great weekend, and we will see you next week. Remember to follow us on all our social media, at Facebook at Apex Center for Regenerative Medicine. Subscribe to our YouTube page at Apex Center for Regenerative Medicine, and follow us on Instagram at RegenerateNJ. Remember, Don't operate, regenerate.